my good friend is back on board with us, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, and Joe's going to talk a little recovery for us this morning. Joe, good morning, my friend.
Hey, good morning, Ray. I know with all that beautiful weather and the time of year it is, for people that just like sports, love sports, sports is in the air. There's no doubt about it. You could see it ramping up all over this time of year, so it's kind of fun. One of my good friends, and just he and I just, average athletes, he even remembers back to our CYO days, riding our bikes to practice. He said you could smell it in the air, and so sports is getting going, and it's kind of exciting. But everybody asks about the kids that were injured last year. Are they ready to return? Are they at risk to be re-injured this year? And just a couple things that I'd outline that I read a little bit about. Often, of course, we use professional players, but this happens exactly the story I'd tell today would happen in high school athletes, college athletes, and so especially those athletes with more significant injuries last year that were post-op surgery-type injuries. How are they going to do this year? And there's a couple of indicators, maybe 4 indicators that we look at in sports medicine. We could take a real common sports surgical injury, and that is the bad ankle dislocation, ankle injuries with fractures. There's 2 bones at the bottom of the ankle, the fibula and the tibia, and they often will fracture and dislocate. And in that injury, very frequently for people that are serious about sports, they would need surgery to get that fixed. It not always would be the case. Perhaps at younger levels, not always, and they mentioned that in the articles. But 2 people that would have an interest in Northeast Ohio, Quinshaw Junkins is the running back who looked so promising for the Browns last year, and Bo Nix, who everybody has spent the whole offseason in football arguing about that what would have happened in the Super Bowl had he not gotten hurt. So Judkins was injured right around Christmas in December and Nix in January. So some of the factors to consider for recovery. Number 1, did they need hardware? When people say that they need hardware, plates and screws to fix that surgery, both of them needed hardware. They were significant injuries. I guarantee you in this area there will be 5 to 10 of these injuries through a career of 40 years here in the next couple of weeks, just in our area here. It's not just football, but any sports with a lot of, high volume of cutting and pivoting, and but especially football, because it also then is the contact with cutting and pivoting that leads then often to the fracture. So number 1 is, did they need hardware? Number 2, did they have a follow-up surgery as they got closer to the season, as we got into the spring and stuff? Did they need to have a look at that ankle again? In Judkins' case, everything I read, couple articles, said he did not have a follow-up surgery done. In Nick's case, he did, and that usually is really from what is number 3 in my list, is did they have previous ankle injuries? There was a little debate around the Super Bowl time with Nick's. What exactly ankle injuries did he have? Did he have a loose body or spurs or previous ankle sprains or even early arthritis? But for whatever reason, he did have some ankle problems, and so in April they did do a second cleanup surgery. And the reason for that is number 4. What we really don't want is the outcome from this pretty routine injury in sports. No surgery is routine, but big injury that occurs in sports. We don't want early arthritis. What really can lead to a very shortened career and long-term disability with people walking with a limp and other things later on is if they get arthritis. So in the second look surgeries and the follow-ups, they want that joint to be, this is what my surgical friends have told me so much over the years, they want that joint to be in perfect alignment, or as perfect as they can get it. If it's out of alignment even a little bit and people are playing high-level sports, they really are at risk for arthritis. So those are really the 4 things. Now those people, both of those 2 players are looking like they're right on track for good seasons, and they're doing great in their camps. I read up on them. today, but they are playing a sport that's high risk. Now, they do have the hardware in their ankle, and that's protective. Some people, even though, do wonder, does that hardware reduce their mobility just a little bit? But definitely preventing injuries, and that's what we need. Preventing arthritis, and that's what we need. And those are 4 of the factors that I wanted your astute sports audience to know about.